When you think about healthcare, you probably think about doctors, nurses, medicine, but have you ever stopped to wonder what's holding the whole system together behind the scenes? There's this powerful and often invisible set of rules called healthcare compliance. And really, it's the hidden framework that makes sure our patient care is built on a solid foundation of safety and integrity.
Now, for this entire explainer, we're digging into material from the real experts in this field, the Praxis Ethica Healthcare Compliance Group. These are the folks who live and breathe this stuff every single day.
So, let's kick things off with a question that really gets to the core of it all. Why in the world is running a doctor's office so complicated these days? I mean, it should be pretty straightforward, right? A doctor helps a patient. Simple. Well, the truth is, it's about so much more than just medicine. It's really about trying to find your way through this incredibly dense and constantly shifting maze of rules and regulations. And if you take a wrong turn in that maze, believe me, the consequences can be huge.
So today, we're going to map out a path. First, we'll get a feel for just how tricky this regulatory maze is. Then, we'll look at the official blueprint that's designed to guide everyone through it. After that, we'll see how you use that blueprint to build a real culture of integrity, create a cycle of getting better and better, and finally, what this all looks like in the real world.
All right, let's dive into this idea of a regulatory maze. I want you to imagine trying to build a house, but with no blueprint and on really shaky ground. That's exactly what it's like running a medical practice without a solid compliance program. You're just totally exposed to all kinds of risks. And listen, the stakes here are incredibly high. We're talking about everything from simple billing mistakes that can trigger massive government audits to accidentally breaking these super complex anti-kickback laws. But at the end of the day, a weak foundation can lead to crippling legal penalties and, honestly, the worst outcome of all, losing the trust of your patients. Okay, so how do you build that solid structure? The good news is you don't have to invent it from scratch. The government's own Office of Inspector General, you'll hear them called the OIG, has actually provided an official blueprint for how to build a really effective compliance program. And this blueprint is built on 7 core elements. It all starts with having written rules, picking a compliance officer to lead the charge, and making sure everyone is trained. Then you need open communication, constant internal checkups, clear consequences for breaking the rules, and a plan to act fast when something goes wrong. Let's zoom in on a couple of the big ones. First up, the compliance officer. Think of this person as the general contractor for your entire compliance building project. It's one person who, as the source material so perfectly puts it, wakes up every day thinking about compliance. They're the ones driving this whole effort, making sure someone is always watching the shop. And then you have the code of conduct. This is basically the rule book. It's the official roadmap that clearly lays out what's expected of everyone. It tells the staff what they absolutely should be doing, and just as important, what they should never be doing. So having a blueprint and a rule book, that's a fantastic start. But they're just paper, right? They're only as good as the people who actually use them. And that brings us to the next critical piece, building a real culture of integrity. This is where compliance stops being a document and starts being how people actually behave. The absolute key here is creating what's called a speak-up culture. You want an environment where every single staff member feels totally safe, raising their hand and saying, "Hey, I think something's not right here," without any fear of getting in trouble. You do that with constant training, open doors, confidential hotlines, and a rock-solid policy that says we do not punish people for speaking up. It's all about catching those small problems before they explode into huge ones. A healthy culture also needs balance. On one side, you need accountability. That means clear, consistent consequences when rules are broken. But, and this is just as important, the OIG also encourages positive reinforcement. Creating ways to reward and recognize the people who are true champions for compliance. It's about showing that there are consequences for doing wrong, but also real rewards for doing right. Okay, you've got the blueprint, you've built the culture. Now how do you make sure it's actually working day in and day out? Well, that's where the detect and correct cycle comes in. This is the engine that lets a strong practice basically police itself. It all starts with detection, and that means you have to be proactive. You have to actually look for trouble. A practice can't just sit back and wait for a problem to pop up. It has to be doing its own regular audits and checkups to find mistakes long before a government regulator ever could. So, what happens when you detect something? The next step is to resolve it, and fast. That means you launch an investigation to figure out what happened,
You stop the bad practice immediately, and you take action to fix it, like, for example, giving back any money you were overpaid.
But the cycle isn't complete, and this might just be the most important part of all: prevention. You have to use every single slip-up as a learning opportunity. You update your rulebook, you retrain your team, and you make sure that same mistake can't happen again. Detect, resolve, and prevent. That's the loop.
And running through all of this is a phrase you'll hear over and over in the compliance world, and it is crucial. If it isn't documented, it didn't happen. Seriously, all of this amazing work, the audits, the training, the fixes, it means absolutely nothing to a regulator if you can't prove you did it. Meticulous, detailed records are everything.
Okay, last section. Let's bring this all home and see what it looks like in the real world. Because a compliance program is absolutely not a one-size-fits-all kind of thing. That blueprint has to be customized for the specific job site, because the risks are totally different depending on the medical specialty. And you can see this so clearly when you look at a few examples. For a cardiologist, a huge risk is proving that all those expensive tests were actually medically necessary. For a rheumatologist, it might be the nightmare of tracking and billing for super expensive buy-and-bill drugs. And for a busy, urgent care clinic, it's all about getting the billing codes right on those super fast visits. Every practice has its own unique maze to get through. Which really brings us to the ultimate point of all of this. A truly great compliance program isn't just a thick binder of rules collecting dust on a shelf. It has to be a living, breathing guide that's just part of the DNA of how the practice works every single day. So, after all of this, we're left with one last big question. When this hidden framework is done right, when it's active and tailored and supported by a real culture of integrity, what does that actually mean for the future of patient trust? Well, it suggests that the very best patient care happens when top-notch medicine and ethical business are built on the exact same solid foundation.